Welcome, everyone, and thank you all very much for joining us. Now, many health practitioners are facing the same challenges today. Clients often do not fully understand what is happening in their body. Compliance can be inconsistent, retention may not be where it should be, and practice revenue can then feel unpredictable. So, in many cases, this is not a clinical issue, it's actually an engagement issue. So today I'm joined by Dr. Okabotha, who is the tutor for the Liveblood online training course. And Dr. Oka has been practicing live blood analysis for over 20 years. He has experienced and overcome the issue of how engagement is so necessary to gain compliance with his patients. So he's also helped many practitioners understand how to use live blood analysis professionally and responsibly in practice. So, Dr. Oka, thank you very much for joining us today.
All right. Thank you, Elizabeth. Great to be here.
I have a few questions for you. So,
Yeah, sure.
many practitioners are highly knowledgeable and skilled, but they still struggle with client compliance and retention. So, why do you think this happens?
Well, Elizabeth, there's a few reasons for this, and it actually comes down to what the clients really understand in the appointment. So many clients do not really fully understand what's happening in their bodies, and if they don't understand the reason behind the recommendations given to them by the practitioners, they are just less likely to then follow through with those recommendations. Practitioners may explain things well to clients, but the verbal explanations alone are often not enough to actually get clients engaged. So the issue is not really the practitioner's knowledge, but it's the client's level of engagement, how much they actually understand of what's really going on with them. And when the client is not fully engaged, then of course results and retention can both suffer.
Okay, so what changes when a client can actually see aspects of their blood live on screen?
Well, it's a very big change in the dynamic in the consultation. Seeing something visually for the client really creates immediate interest and curiosity. Clients become a lot more involved in the actual consultation. It also helps bridge the gap between what the practitioner understands about the client's state of health and what the client actually understands as well then from what the practitioner is explaining to them. So the client is no longer just being told what to do. They are actively participating in the process, and this can make the consultation itself much more memorable and meaningful to clients.
I should imagine it makes the appointment far more interesting as well, being able to see
Oh,
their own blood.
absolutely, far more interesting. It changes the dynamic completely and really gets the client a lot more engaged in the entire process. So really a huge difference, yes.
So, how can live blood analysis help improve the client compliance with the practitioner's recommendations?
Well, when clients actually understand why these recommendations are being made by the practitioner, they are just far more likely to follow these recommendations. This visual education then make things like nutrition, hydration, lifestyle, stress, these abstract ideas like inflammation and oxidative stress and these other patterns just a lot easier to then discuss with clients. Clients become more motivated because they can actually connect their dietary and lifestyle choices with what they're seeing on their screen in their own blood sample. And the practitioner can then use the session also as an educational tool, not just an assessment, but to actually educate the client about what impact various choices in their diet and lifestyle is having on their health. And this helps clients then to take greater responsibility for their health journey, which is, of course, a very, very important factor in, the natural healing process.
So they can actually see what effect their diet and lifestyle is having on their health.
Absolutely. And for them to be able to connect between what they're seeing in their blood with the specific choices they're making in terms of diet and lifestyle really is extremely powerful, and helps to motivate, changes, positive changes for them to make in their diet and lifestyle.
And then I suppose they will also see in follow-up appointments what changes in the diet and lifestyle, what effect it's had on their blood. Yes.
Absolutely. And then, people actually want to monitor the progress. They want to see how things have changed. So follow-up appointments become a lot easier, and it allows the practitioner and the client to review these changes visually over time as well, which is very, very valuable. Seeing this progress and how things change can really reinforce compliance and motivation for clients. And if they have not followed the plan, then the follow-up also gives the opportunity for the practitioner to re-engage with the client and for them to get back onto the protocol. So this improves retention overall in the practice, and creates a far stronger practitioner-client relationship.
Okay, so does it also encourage clients to return for follow-up appointments and stay more committed?
Absolutely, it really does. So this visual confirmation, being able to see changes actually taking place as a result of changes that they've made in their diet and lifestyle, really helps to reinforce everything, and it improves, what we're seeing in terms of people coming back for clients for follow-ups, and also the types of changes taking place during follow-up appointments as well.
Okay, wonderful. So from a business point of view, how can live blood analysis help a practitioner grow and stand out in the marketplace?
Well, live blood analysis just gives practitioners a strong point of difference. It's something quite different to offer to clients, different from what other practitioners are doing. And the visual experience really is extremely valuable for clients. Now, it's quite simple in that it can be added to an existing practice without really having to change the way that the practitioner or the practice works, completely. It can slot in very, very easily, and it can support consultations, packages, follow-up programs with clients, and client education as well. Live blood analysis also can create an additional revenue stream in practice, because often practitioners charge separately for this as an analysis. And being able as a practitioner then to offer something much more visual and much more interactive and memorable is a very big point of differentiation then.
It's also something very unique to offer, isn't it?
It really is very unique. It really gets people quite excited. So often we see people coming in, one family member coming in for a consultation, and then because of what they've seen and experienced during the consultation, they want to then see what the rest of the family also looks like. So often, the mom would bring the children and the father along as well for blood analysis, just because of that, unique experience with seeing your own blood on a screen.
So some practitioners may think that you can simply buy a microscope and start using live blood analysis, but proper training is very, very important, I understand. Can you maybe explain a little bit about that?
Yes, yes, absolutely. So proper training really is extremely important. Live blood analysis is quite technical. There's a lot of theory involved with understanding the specific anomalies that are covered in live blood analysis, their potential implications, what sort of things you have to bear in mind in terms of diet and lifestyle, and also medical background and so on with regards to those anomalies. So very, very important to have proper training. The way that the training is also paced is very important because of the amount of theory to cover. Going for a 2-day sort of weekend course where you learn about live blood analysis really isn't enough time either. It's a fairly steep learning curve. There's practical aspects as well involved with taking blood samples correctly and to actually view them. There's a specific way that they're actually viewed under the microscope as well. So all of this needs to be covered in detail in a training course. Practitioners need to really understand properly what they're seeing under the microscope, and they need to understand how to explain it appropriately to their clients as well. So poor training and unsuitable equipment will lead to confusion, frustration, and a lack of confidence in the practitioner. So very, very important. Practitioners should stay also within their scope of practice and avoid inappropriate diagnostic claims as well. So that's also very important to consider there. And proper training gives practitioners the confidence to use live blood analysis to its full potential professionally. So all these factors, are covered in detail in our training course.
And do practitioners need to know how to use a microscope?
Yes, absolutely. The practical aspects really are important. So the taking of the blood sample, that will determine, whether you're taking the blood samples correctly will determine whether you get repeatable and reliable results from the analysis. And the type of microscope that's being used also is extremely important. It needs to have the correct features. And the use of the microscope, as you said, the viewing of those blood samples, what type of settings to use with what type of sample being viewed, all of those are extremely important, and practitioners need proper training on that.
So they don't need prior experience in microscope use, and everything's taught on the training course?
Yes, yes, absolutely. So, it's not necessary that practitioners have some pre-existing experience with using microscopes. We cover all of that in detail in the course. The information provided is really provided for practitioners with the assumption that they've never had any experience on the microscope before. So, we cover everything from the basics to how it applies to live and dry blood analysis.
Okay, thank you. So, can you explain how live blood analysis online training course, or how the live blood online training course helps practitioners to add live blood analysis to their practice with confidence?
Yes, yes, absolutely. So as I mentioned, it is quite a technical subject. There's quite a lot to learn, theory as well as practical aspects. So we've structured the course in such a way to provide this information and to allow practitioners to absorb and assimilate this information, as well as possible. So it's structured and fully supported. The pacing of the course is also worked out in such a way that practitioners are able to assimilate the information. We help by guiding practitioners every step of the way. They learn what they are seeing in the blood, live blood samples as well as the dry blood samples, and how to use live blood analysis as a professional tool in practice, to complement and support what you're already doing in your own practice. The training helps practitioners to learn how to integrate live and dry blood analysis into their existing practices. And we include detail in terms of the theory, the actual training, practical guidance in terms of using the equipment, and of course after training and support after the course as well. So ongoing support and ongoing training is available, included in the training course as well. The aim of the course is to help practitioners get started as quickly as possible, and to then build confidence over the 12-week training course.
Okay, thank you. And wonderful. And finally, what would you say to a practitioner watching this who is struggling with client engagement, compliance, retention, or unpredictable revenue?
Well, live and dry blood analysis may be what you actually are lacking in your practice. It is a powerful way to improve client understanding and engagement in practice. It helps clients become more involved in their own health process. It moves that focus away from what the practitioner can do for you to what the client can actually do for themselves in terms of their own health. So it helps to help them to realize that they should be taking responsibility for their own health. And it also helps to improve follow through, retention, and practitioner confidence in practice. It really can add a valuable new dimension to an existing practice. So, really, something extremely valuable to look at. And for practitioners who really want to stand out and offer something more visual and engaging to their clients, live blood analysis is definitely well worth exploring.
So thank you very much, Dr. Ocker. And if you have been watching this and thinking that live blood analysis could help your clients understand their health more clearly, improve engagement, encourage better compliance, and add valuable new revenue stream to your practice, then we would like to invite you to look at the live blood analysis online training course. So this is a 12-week practitioner training course designed to help you to learn live blood analysis in a structured, professional, supported way. We'll send you the recording of this meeting together with information about the course and enrollment details. And if you'd like to find out how to add live blood analysis to your practice, please click the link that we send after this Zoom meeting or reply to the email, and we'll be very happy to help you take the next step. So we hope you found this helpful. Thank you very much for joining us, and we look forward to seeing you on a training course soon. So thank you very much, Dr. Ocker, and thank you. We will be sending you all the information, and as I say, look forward to seeing you on a training course soon. Thank you.
Thank you.
Thank you. Bye-bye.
Bye bye.